Here we see a picture of an infiltrated IV. You can see that there is redness, there is swelling, and the person has probably complained to you about pain. If you touch this, it probably would feel kind of cold to the touch because of the fluids that have seeped into the surrounding tissues. And they will reabsorb after a while. You just don't want to keep pumping them in. This is what you might see with an infected IV site. Notice the concentration of redness, the kind of pussy looking appearance. If you touch this, you would feel heat from all the white blood cells and macrophages collecting around that area to clean up that infection. Often you're still going to do the same protocol, inspect the site, stop the infusion, call the healthcare provider, and in this case the person might need antibiotics, so you would leave that up to the healthcare provider. You can still do the warm compress if it would make the person feel better. This is a condition called extravasation. Infiltration and extravasation are not the same thing. Infiltration just means you have a leakage of solutions into the surrounding tissue, but it's not irritating solution. Sometimes it's just plain IV solution. And it's not going to eat away at their skin. Extravasation is a leakage of what's called a vesicant, a irritant, a medication that is caustic or toxic to the surrounding tissue. Now this is an example of leakage of an irritating solution into somebody who had a central line. They had either a central line or some kind of a port, and it leaked into the surrounding tissue. They have an area of necrosis that you can see. It looks like there's eschar or scar tissue on top of that lesion, and then all kinds of redness and irritation around it. So this is probably a lesion that where the person would have to go into surgery, have that debrided, taken off them, packed, and then IV antibiotics, probably for a long time. So this is just an example of what it can look like, but it can also be in the hand or the arm if it's let go. So you want to make sure that if you have an irritating solution, like potassium, for instance, really irritates. Phenergan, very strict guidelines now for how it can be given IV, because in the past it's acted as a vesicant and caused tissue necrosis. You just have to be very careful and always listen to your patient. Always, always. If they say their IV hurts, listen to them. If you don't see anything wrong, if it's not swollen, not red, not taut or hot or cold when you touch it, you can reassure them that it looks okay. I've had times where I can't see anything wrong, but I've offered to change it just because they're complaining of pain. Sometimes they would take me up on it. Other times they'd say, no, if you think it looks okay, just watch it. And then you have to do just that. You have to watch it. Listen to what your patient's telling you. There's nothing as frustrating as following a nurse who's given you a report and everything's hunky-dory, and then you go into the room and the patient's left hand is twice the size of the right hand, and they say, I've been calling and calling, but nobody has paid any attention to this IV. Ooh, just one of my many pet peeves. Listen to the patient and try to fix it for them. All right, now, we have talked about enteral medications. We have talked about parenteral medications of different types. Now we are going to talk about what's known as percutaneous administration. Percutaneous refers to administration of medication through the skin or the mucous membranes. And there are two types of, let's see, how do I describe this? Many times people will confuse topical and transdermal. They are not the same thing. Topical, both meds are applied on top of the skin, but topical means you're treating something on top of the skin. Transdermal means that medication is intended to absorb through the skin and enter the bloodstream and become systemic. So two different things. Just make sure that you are very clear over whether something's topical, meaning the med is just going to work on a skin surface or a mucous membrane surface, or if this medication is intended to be absorbed and go systemic. For example, nystatin powder on a yeast infection is meant to just treat the surface of the skin, but it's not meant to go systemic. On the other hand, transdermal patches like nicotine or nitroglycerin patches are intended to be applied to the top of the skin, but over a period of time, a number of hours, depending on what it is, it soaks into the skin, goes into the capillaries, and is slowly carried throughout the rest of the system. So make sure you don't mix up transdermal and topical. On page 56, we have some different factors that affect transdermal application. You don't want to put transdermal patches over skin that has hair. You don't want to put it over places that have a lot of scar tissue. And all topicals depend on skin condition. You don't really want to put any kind of topical or transdermal drug on broken skin. Anytime there's scar tissue, there's going to be a difference in absorption. It just depends on what you're treating. Now, the ways you can apply a topical are mucous membranes. If it's not the skin, it's mucous membranes of the ear, eye, nose, mouth, and vagina. You also can do some topicals in the rectum, but once again, is this a medication that is only treating the rectal area, like Preparation H, that's made for hemorrhoids at the surface of the rectal area? Or are you talking a suppository that's going in and absorbing into the system because the person can't take PO? There's a difference in how you'd administer Preparation H to the surface of the skin where there are hemorrhoids and where you put like an aspirin suppository because your patient can't take anything PO. So once again, think about how this medication is being administered. Topical meds come in creams, powders, ointments, lotions. Inhaled meds are still considered topical meds, even though they go into the nose, up into the sinuses, and in the lungs, because they are affecting the surface of the skin. So it can be a little confusing. It's like, okay, I'm sucking something into my lungs that's going to work on my lungs and open them up. Why is that not like transdermal? But it's considered topical because you're working on the surface of the lungs, whereas transdermal is meant to be soaked in and go into the bloodstream. Just ask yourself, is this a drug that's going to be going into the bloodstream eventually or not? So nicotine patches, nitroglycerin patches, that's going to soak into the bloodstream. Something rectal, such as a rectal suppository with medication like an aspirin or a Tylenol suppository, they're going to be soaking into the skin, whereas a laxative type suppository is just going to be working on the surface, on the contents of the bowel. So your ultimate question has to be, is this something that is going to go in through the bloodstream and go circulate throughout the body?